Question. This is actually perfect for you. Are lactation consultants available every day? I'm worried as I struggle with my first within the first few weeks.
Yeah, fair. So I might be a little bit biased, but
Okay.
our nursing staff is amazing and excellent, and everybody is trained in breastfeeding assessment and education. We do have varying experience levels, but generally speaking, there will always be somebody on the shift who can help you breastfeed your baby.
Right.
We do have a limited number of IBCLCs currently.
Okay.
Right now, but you do have access to an IBCLC. It just may not happen on that particular shift.
Right.
That being said, we always refer to public health
Yep.
for families who do require additional support with breastfeeding. So hopefully we're not missing anybody and
Absolutely.
no one's getting, caught in the cracks. But if additional support is required outside of the hospital, we always endeavor to get that referral in.
Yep.
And for those who don't know, families after discharge can always self-refer to public health for lactation support.
Yep.
So we give all that information at discharge as well.
Yep.
But yeah, so
Absolutely.
The answer is yes, we do have IBCLCs, but unfortunately it's just not every day or full time.
Right. Mm-hmm. And then with that being said as well, you guys are launching a new breastfeeding class.
We are. Very exciting. So we have a breastfeeding class that's starting in September. It's going to be offered twice a month right now.
Awesome.
And hopefully, fingers crossed, if it all goes well, we may expand and maybe offer some more. So yes, please come take our breastfeeding class. We're very excited to get it started.
And that information they can find on the website or?
On the website. The information is getting dispersed to the obstetrician's offices as well, family physicians' offices. I think we'll be doing some social media initiatives to get that information out also. So yeah, I think that's a great, I've been wanting to do it for a long time, so I'm excited.
Yes.
The other thing, just to let people become aware of, is we do also have an outpatient program. So if a family is having immediate feeding concerns or they're concerned about jaundice in the first 30 days of life and they've had their baby here at Woodstock Hospital, they are welcome to come back to visit us on the floor from Monday to Friday, 9 a.m. to 3 p.m. It's technically a walk-in service. If you're able to give us a call and we can set up an appointment, that's always a little bit appreciated, just so we can plan our day. But it is a walk-in service. But that's only Monday to Friday, 9 to 3.
9 to 3.
So outside of those hours, if there were concerns, you'd reach out to either public health or come into Emerge, depending on what the concern was. But that is just an additional service. That person may or may not see an IBCLC. It just depends if we're on that day. But they will at least see a nurse who can assess and assist with breastfeeding.
Right. As well as early on, and Megan from First Five, we run the breastfeeding hub, which runs once a month. It's now moved to Fridays, 9 to 11. And that program is for if you're struggling or if you're wanting to start weaning or wherever you are in your feeding journey, you're welcome to do that. So there's lots of resources out there to hopefully, like Amanda said, that no one is falling between the cracks. And if you are looking for additional supports, then in the email below, you can send me an email and we'll send you all of the referrals that we just said.
There's lots of help out there. We just need to access it.
Absolutely.
Sure.
Okay. So on to the next question. I want to have an unmedicated birth. Can I move around and try different positions when delivering my baby? Does the bed move into different positions?
Yeah, absolutely. So we encourage movement and ambulation in labor. We want you walking. We have and will suggest, different things to help keep labor moving and keep you moving in labor. The beds are very fancy. They go in all sorts of fun positions. We do different things with them depending on what stage of labor you're in. We often will use peanut balls as well, especially if you have an epidural. We often will use the peanut ball in the bed with you to help keep physical movement happening throughout the labor process, because we know how important that is to help bring baby down and have a vaginal delivery. We also offer, we have a curb that patients are able to walk along. So that's been a handy little tool, especially in early labor. We have birthing balls, we have peanut balls. And our new fun little tool that we have is called a Cub chair. It stands for Comfortable Upright Birth. So it's just another tool that we will use. I love it in labor for people to lean on. People will sit on it. If you don't like the rolling of the ball, sometimes that's nice. You can just sit on it. But yes, this bed will do all sorts of fun positions and allows for a squat bar also. So if they wanted to
Okay.
use a squat bar, sometimes
Yes.
for squatting or sometimes just for helping with pushing.
Yep. Yep.
But yeah.
So they're not stuck to the
No.
old-fashioned legs up. They can move
No.
around, deliver however
There are
safe.
situations where they might need to, we call it break the bed, where we remove the bottom part of the bed. And usually
Okay.
that's for instrumental deliveries or
Okay.
deliveries where we worry that perhaps we might need to intervene in some way. So
Right.
that does happen. But if a patient has a preference and they really, want to deliver in a specific position,
Yep.
That's a great conversation to have, and we will advocate and do our very best to help them do that.
Yeah. Awesome.
We're seeing a lot more women wanting to deliver on all fours, which is great. We know that, physiologically, anatomically, that is what makes a lot of sense. So we're seeing a lot of people choosing to want to deliver in that position.
Yeah.
Sometimes with an epidural, it's a little bit trickier.
Yes.
We do a little bit of finagling, but
Yeah.
no, we will always endeavor and advocate to deliver in whatever position you want. And we may even say, hey, like, I think you should push on your side in this position, or we should try this, depending on what we think the baby's position is.
Right.
So yes, we absolutely encourage movement. We want you to move.
Right. Yeah.
Yes.
And I think a good point to add in too is that we often hear in our baby groups is that moms forget that once you have the epidural, you can't get up and move around as if you didn't have an epidural, right? So,
but just because you're with an epidural and you're in the bed, there are some things we can do. Like I said, the peanut ball is amazing. We love that peanut ball. So if you get an epidural, you can pretty much count on the fact you're going to meet the peanut ball.
Yeah.
But yeah.
Which later on in the video, we will show different positions of the bed as well as the peanut ball and what other tools that you guys can see. Awesome. Okay. The next question is, can I have a water birth in the bathtub?
Again, a very common question we get.
Yeah.
So our tubs are amazing for laboring in.
Okay.
They have they have jets. They're lovely to labor in. Unfortunately, though, it's not the safest option for a delivery.
Okay.
So we cannot, unfortunately, deliver in those tubs, but they are very therapeutic for laboring in.
Yes. Yes.
So,
yes.
yeah.
Okay. So it's still an option to go in there until delivery.
But for the actual delivery, it's not a safe option.
Right.
Technically, for a water birth, we should be able to access
all
the family, the baby, the perineum, everything from all areas of around the pool.
Yeah.
So unfortunately, we can't do that here.
Right. Okay. Next question. So what is the likelihood of needing a second induction after having one with my first?
Okay, that's a great question, but it is a little bit tricky.
Right.
So I think it all depends on the reason for the first induction. Okay. So things like patient history, the pregnancy concerns, the gestational age, the position of the baby, how ripe the cervix is when the induction process gets started. I think that all plays a role in how the induction results.
Right.
So in short, it's complicated, but just because you have an induction the first time does not absolutely 100% mean you need an induction with a subsequent child.
Right.
I think that's a great question to bring up with someone's doctor, because then they can discuss, what were the concerns the first time around? Do we have those same concerns this time? Why did we need the induction the first time? So the short answer is no. Just because you have one the first time does not mean you need one the second time. It's just complicated because there's a lot of factors at play to decide when it comes to induction.
Right.
Yeah.
Right. Okay. I knew that would be a tricky one too, because it does depend on so many different
things. And, pregnancy to pregnancy is different.
Right.
And, again, the big thing is, why were we being induced the first time?
Right.
Because, sure, if you were induced because you're 40 years old and so we're being induced for advanced maternal age, sure, 18 months later, you're probably going to be induced for the same reason.
Right.
Versus, did we have a blood pressure issue? Was there a growth issue that the baby was no longer growing and it was safer to be out than in? So again, there's it's a complicated question. But I think speaking with the doctor, knowing all the ins and outs of what happened before and what's going on with the current pregnancy, that's the better way to get a better answer.
Yeah. So please have a conversation with your health provider.